So, we are starting again with the lung and heart auscultation. I wrote a quick little diagram just to give you a visual representation of the heart at first. This is the aortic area, second intercostal space. We're going to hear the dub part of the heart. So this is a quick reference video. If you need something more in depth, go to the nurse Sarah on YouTube. She's a great resource for anatomical explanations, but let's just get down to business. Second intercostal space right here is going to be the pulmonic area. This is where you're hearing the dub. Both these parts are on the second intercostal space. So you're gonna hear the dub portion on those sites only. And for the lub, there's 3 points. There's Erb's point. This is going to be in between the third intercostal space and the mitral and tricuspid valve areas. This is just the area that the heart sits in the middle of the chest. This is just a rough visual representation, and these are going to be around the fourth and fifth intercostal spaces. Now, I'm going to show you on a live subject here. My buddy Jamie's going to help us out. We also have some areas here in the lungs. You're going to essentially, there's other in-depth videos, but we're going to try to hit the main lobes. On this right side, their right side, it's going to be switched when you turn them posterior. So just know that when you're listening to the lungs, when you switch them, the lobes change because their position changes. So we have on the right side, you're going to have 3 main areas because you can hear 3 centers of the lobe with the lungs. You start at the apex of the lung all the way to the top. It's good to know what these look like on the front and on the back because they're only accessible on the front to really hear certain parts of the lobes. The middle lobe is going to be kind of right under the nipple. This kind of follows up on the other side here. You can see it's right between the vertebral column and the scapula area. There's a lot of meaty muscle here in between, and there's bony substance, so this is really the only accessible portion. You can listen all the way up from the neck area all the way down to the side, and you can even go onto the intercostal spaces laterally. So you're going to listen here essentially to hit this top portion of the lungs on the other side. You're going to start at the apex. That's about 2 meters superior to the medial clavicle. So you're just going to follow that up. Listen. You should be able to hear. What you're listening for is clear quality of noise. What's the loudness? What's the duration? Is there a pitch between inhale and exhale? And make sure to explain to your subjects that they want to have equal time in between. Just telling them to breathe normally, right? You don't want them to try to adjust that. But I mean, if they breathe slowly, you're going to be able to hear any sort of rails or bubbling, rattling, rhonchi, which is snoring. That snoring noise, that real aggressive. If they're sick with that, stridor, which is going to be a wheezing type of noise here. And why we do the auscultation of the lungs and the heart simultaneously is because they can definitely have if someone's sick, there can be an effect on both. For instance, if you auscultate the diaphragm of the lungs and there's crepitus, that can indicate a pulmonary edema. So there can be co-lining symptoms here. So now I'm going to show you my buddy Jamie here. We're going to start right with the heart. And here, I'm going to have my other partner show us here. So the second intercostal space, you're going to do some palpation. Starting from the clavicle, you're going to kind of meet this midline here. And you're listening for that dub portion here. It's going to be a little more faint. This is the heart. And you can actually listen for the lungs while you're doing this as well, because this is going to be where the other valves are as well. So we hit that. We're going to go right on Erb's point here. And you're going to have to get some practice finding this. There it is. And this is very clear. This is probably going to be your best shot for taking a look at the heart and hearing these contractions of the muscle. So now starting for the lungs. Lungs is going to be a brief. You can go all the way to the side, the mid-axillary, and we're going to start at the apex of the shoulder here. This is going to be the upper lobe. Very strong. You can hear it on the anterior surface here. You always go bilaterally and you kind of follow it down. Right. Be careful not to mix this heart sounds also. You can follow. You're going to hear a little bit of the heart as well, all the way down. So you're going to hit that fourth and fifth intercostal space. You're going to go all the way to the mid-axillary. And you're listening for clear quality sound between the inhale, exhale. Tell your patient to breathe slowly. The slower they go, the better. Now Jamie's going to turn posterior. He's going to turn around here. And essentially you can see here, we did some cupping. This is his vertebral column here. So you're not going to be able to hear much of the lungs here. We're going to hear a lot of upper and lower lungs with these. But with the scapula, there's a lot of median muscle there too. So it's really in the center. You're kind of going all the way up and the lungs kind of cut off right on the latissimus dorsi. And you're going to go right for the apex with this too. Inhaling and exhaling, you're going to instruct your patient. And also, we'll go over something right at the end here. Always going bilaterally, you want to hear both of these lungs. It's going to be very, very prominent here. Nice, clear, quality sound. No crackling whatsoever. Get some practice. You got some sick people, you're going to know that when they're coming in. And that gives us another point. Jamie's been a great patient. You want to know why you're doing this. What are you doing this for? Is this a pre-screen? Or is this because they're coming in with something? Are you qualified to do this sort of eval? So this is for quick, informative purposes, just to kind of give you good cues on where to go for both your heart and lung auscultation videos. Refer to the nurse Sarah for very specific and reasons why, different conditions that you're going to hear. And yeah, great resources online, and hopefully I helped you out. Thanks.